The views and opinions expressed do not necessarily reflect those of Access Fort Wayne, the Allen County Public Library, or any other supporting groups. If you'd like to produce a show, call us at 260-421-1250.
Hi, I'm Dr. Rudy Cashman, a neurosurgeon, Fort Wayne, Indiana, for 41 years, but I'm only 39 years old. Tonight we have a very interesting subject to discuss, and I have a number of guests with me today, which I'll introduce you in a minute. And this program will be about mindfulness, the treatment for chronic pain and stress. Stress is a cause of about 20-30 mind-body diseases, which I've written books about. It's also the cause of a great deal of chronic pain. Instead of injections, procedures, narcotics, we use a integrative, holistic approach for these conditions, and that's what we'll be speaking about tonight. With me on my right, on your left, Dr. Richard Johnson, professor at IU Purdue for over 30 years, who will teach a mindfulness course at the Cashman Mind Body Institute. And we have with us also one of his clients that has been attending his mindfulness class. We're going to interview him a little bit and find out if you liked the class or not, and how he reacted with Dr. Johnson. This is going to be a very interesting evening, something a little different, but I think of great help to get you well. The first thing I'd like to ask you, Dr. Johnson, is what's a good definition of stress?
Well, one of the most important things about stress that most people don't realize is it's based on our perceptions. That we don't just encounter stress, we encounter stress through the way we look at the world, through whatever's happening to us. For example, if you and I are playing a game together and you're feeling all right about yourself, and maybe you're not playing so well that day, you don't have to feel stressed. You can, but you don't have to. But if you don't have a good self-concept, if you don't feel good about yourself, and you've had a terrible day, then it's much easier to be stressed. So perception plays a role in whatever happens with us, and then how we handle it. Something is outside us that's stressful, something that's inside us is stressful. But either way, it's so much connected to our perceptions of what's going on in our lives. One of my sons lost his job for Toyota, and he didn't feel a lot of stress because he and his wife had good savings, and he knew he'd get a job. But if they hadn't, it might have been much more difficult for him. And then there's that inner confidence. You know, there's something called being stress hardy. If I'm going through life and something happens and I don't feel so great about it, if I'm stress hardy, I have a way of kind of moving with it. So internal factors play a major role in whether we see something as stressful or not.
Very interesting. In other words, we can become hysterical about it. We can not sleep about it. We can develop mind-body illnesses because of it. We can develop pain syndromes because of it. And I've taught a little bit about stress myself. And one of the definitions I've used, inability to cope with perceived, real or imaginary stresses to our psychological, physical, and spiritual well-being.
Yes.
There's about 1,000 different definitions, but I thought that's kind of interesting. We all have stress in our lives, don't we?
Sure. Yeah, it's
every
natural.
day.
It's natural. It's part of the human condition. Yeah. The question is only what we do with it, and do we get more hardy? Do we develop ways to deal with it better, or does it just overwhelm us? One of the main things about stress is it's times when we feel overwhelmed and we feel like there's a sort of a danger to our self-concept, a danger to who we are. And if we're able to say, well, it's just happened, something happened, life happens, then we're able to move forward a lot better.
And that's the reason for this program, so that we become educated about it and try to teach you how to deal with it. Because I'm a neurosurgeon. Heck, I face it every day.
Sure.
And you know, what do I do? You know, breathing techniques, mindfulness techniques. I play sports, play the piano to try to get under control. Stop at Starbucks, have a cup of coffee. You know, these are all stress things.
Whatever works for each one of us.
Exactly. Now, tell me this. Dr. Johnson, what's the difference between acute and chronic stress?
Well, acute would be in a case of, let's say, there's this tiger, and this tiger's about to pounce on us, and then
that's acute.
and all of our systems should kind of go crazy, because in that moment, you know, physiologically, our immune system shuts down, our digestion shuts down. All those things happen because we have to. Everything has to deal with that moment, and that's natural, and that's all through human history. Chronic is when, of course, when it goes on and on past a certain point where day after day after day we look at our lives and we keep feeling stressed. We keep feeling like I can't make it. You know, if, my job's not working out, family is not working out. I feel miserable, and I keep fueling my stress with my own thoughts and feelings. And it's stress, it's real, but I'm also fueling it. I think that's what leads to chronic stress.
Yeah, and it starts leading our lives, and then the stress can come out in us as ulcers and heart disease and irregular heart rates, skin rashes, constant headaches, irritable bowel, fibromyalgia, depression, anxiety, insomnia. These are the chronic stress illnesses that can come out as. I mean, it's very interesting. And it's the acute stress is the sympathetic reaction. And that's where the adrenaline comes out and our blood pressure goes up and our pupils dilate and our bowels shut down, our bladder shuts down. We get skin rashes, we start sweating, our blood pressure goes up, our heart starts racing. That's the acute reaction. And then we have the chronic reaction where the bowels start working again and we start eating like anything. Matter of fact, to have a obesity, for example, is very common in stressful people because they're overeating. All those stress steroids stimulate our appetite. The second subject we'll be discussing today is chronic pain. What is your definition of acute pain and chronic pain?
Well, acute is usually lasts like you break a bone. Something happens and you've got acute pain. And that usually lasts a fairly short amount of time, less than 6 months. Sometimes they talk about 3 months, but certainly less than 6 months. When pain continues past 6 months, then it's generally defined as chronic pain.
I would completely agree with that. And I see a great deal of it, of course, in the neurosurgery practice. Acute pain, 10% of the pain problems. We put a cast on there, give some narcotics, and we stop them. That's an end point. The problem that I've been seeing in my practice is with chronic pain. That's pain more than 6 months. And a lot of these patients, we don't know why they have the pain. That's really the problem that I've been witnessing. They have neuropathic pain, which is nerve damage. I mean, you damage the nerve, you amputate a leg or something, or trigeminal neuralgia or a pinched nerve, but that's only about another 10% of the pain problem. And to treat them short-term with narcotics is fine, but they have found, researchers have found, Kim, that you may not know this, that opiates only help 30% of the patients with chronic pain 30% of the time. That's a small amount of people. Why would you give narcotics long term? But I see it all the time. And what happens to these people? They become addicted. They're addicts. They get sensitization from the narcotics. And there's a world of these patients out there. In our surrounding counties, Richard, you will not believe, we had 70 deaths last year from physician prescriptions. And you can imagine what's happened over the nation. That's why we are doing tonight here as an alternative to this heavy use of narcotics. In mindfulness, you don't need these medications. And we'll discuss that in great detail. You've heard me talk previously, Richard, about metabolic pain. What I call metabolic pain. Remember we spoke about chronic pain. Only 10% is neuropathic, 10% is acute. A little bit is nociceptive, that's tennis elbow or carpal tunnel or something of that nature, but we get 50% of the people come in to see us say they hurt. but we don't know why they hurt.
Yeah.
I read 3 pain books. They never brought these people up. 50% of people come to the emergency room and say they hurt. We don't have a diagnosis. To me, Richard, pain is not a diagnosis. It's a symptom, and I think you would agree.
Yes.
It's a symptom, not a diagnosis. So what, are we not going to call those patients anything? Say it's in your head? Heck no, the pain is real.
Very real.
It's due to anxiety. It's due to their stress. It's due to their anger, no matter what. So I like to call that, let's call it tonight, metabolic pain. And a name is reasonably friendly, but identifies these people where the pain is real,
Yes.
but the treatment should be different than a narcotic.
Yes.
You know, while we're on that subject, the Buddhists speak about acute pain as arrow number 1.
Yes.
They call it arrow number 1. I think it's a good definition. You take care of the problem, you put a cast on, you narcotics for a month, and it's over. So arrow number 1 is small. But then we have arrow number 2. Arrow number 2 is huge. These are the patients who come with chronic pain. 50% of them, we don't know why they hurt. It's anxiety, fear, depression, anger. To handle narcotics, it's ridiculousness. And because it's based really on the human mind. And to start injecting these people's backs and doing procedures to the spine, it is totally ridiculous. You would agree, wouldn't you, Richard?
I would
mean, it's
so
a totally mistreatment.
Right.
The problem is in their brain. It's real. It's in the chemistry of their brain.
Yes.
And it's in the chemistry of the brain, and it is not located in the spine, although the pain may be there. It's in the chemistry of the human mind. A very interesting subject. Wouldn't you agree that might be a good way to describe these patients,
I think
Richard?
those 2 arrows is so helpful because people say, well, how can changing the way I do things, changing the way my mind works, changing the way my emotions work, how can that make a difference? Because I feel pain, and my pain is physical. But what is the origin of it? When we understand the origin, which is, that acute pain that happens, that we're hurt in arrow 1, but when we look at arrow 2 as bigger, and that we can do something about that, we have options about how our minds and hearts work, which change what we actually experience.
Thank you, Richard. I totally agree. And you have to remember, I got 41 years of experience in this. I'm a surgeon. I look at both sides. I know what needs surgery. I know what doesn't need surgery, which I think puts it puts some credibility into the situation.
Yes.
And so tell me, Richard, how does mindfulness teaching help in the treatment of stress and chronic pain, which we teach at the Cashman Mind Institute, in which you teach? I mean, to begin with, maybe you could say, what is mindfulness? What is mindfulness?
Mindfulness is the ability to live right now in this moment, to be present in this moment, to be aware of what's going on, to do it on purpose, to make sure I'm doing it as much as I possibly can without judgment. I give an example. So something happens around me, and I begin to react against it, and I say, it's just happening. This is happening. Maybe somebody walks by me, and they usually say hi, and they don't. I could have this big deal about it. Oh my gosh, they don't like me, whatever. Instead, I just say, he walked by. She walked by. So I'm observing. I'm able to watch what's going on in my life from a place that's not my physical sensations, it's not my emotions, and it's not my thoughts. It's something higher and deeper. We can call it awareness. In a Christian term, we can call it spiritual or the soul. It really doesn't mean any difference what you call it. There's a capacity to observe, and when we observe, remember about stress is we feel overwhelmed. We perceive things as
we're looking at the past and the future.
Right.
Here we're not looking forwards, we're not looking backwards. It's not egocentric.
Right.
It's just what it is.
Right here, it's like we use the image of glasses. If the past really hurts me, I feel a lot of pain in the past, then I'm looking at everything through my past glasses or through muddy brown glasses, and everything looks muddy brown, right?
Yeah.
Or let's say I'm looking in the future and I want it to be a certain way, so I'm looking at everything through rose-colored glasses. Oh, everything's going to be great. Well, in either case, I'm not actually seeing this moment, seeing this jacket, seeing Kim here, seeing the people here just as they are, then I'm off in some kind of fantasy trip, and I'm not living really here. When I live really here in the moment, we can look at it as a timeless moment. Mostly stress is related to time, right?
Yes.
But if you're playing tennis or you're in the garden or whatever feels right to you, you can just be here. And in that moment, there's not the phone, there's not the job pressures. Right now, you're just here. And we can learn to do that more and more of the time. And as we are more mindful, we're less stressed.
It's like looking in the mirror, isn't it? It's just bouncing right back,
Right.
no judgment.
Right. It's
The
completely
mirror doesn't
accurate.
make a judgment. It just shows you exactly what you are.
Right.
That's really mindfulness,
Right.
Isn't it?
As long as the mirror is clear. But sometimes the mirror is getting foggy, we can't really see.
Yeah, no judgment, no biases.
Right.
I think that's just great. And mindfulness, which we plan to explain today and teach, really can stimulate your own morphine, your own endorphins in your own body. See, what other people do not realize, you don't have to take externally, take a bunch of narcotics. The only reason they work, you have receptor sites in your own body for them, and you yourself make them. Where is your own morphine made? Where are your own endorphins made, which have been described pretty well since 1972. They are made in the arcuate nucleus of your hypothalamus. That's just above your pituitary, the base of your brain. And then they get made in those cells right there. And the solitary nucleus of the brainstem. That's where the body's own morphine is made. And then it goes down the axons and leads to other areas in the brainstem and spinal cord to reduce pain you might be having. It's for example, they are stimulated in Lamaze. You do deep breathing exercises, you're having a baby. And I recently had a chiropractor's wife down the street here, matter of fact, who attended a lot of my classes. And I asked her when she had a baby at Lufen's, I said, Oksana, what type of anesthetic do you use? Dr. Cashman, I attend your mindfulness classes. I didn't have any anesthetic. I did breathing techniques, and I had no pain whatsoever. Now, we're not generally suggesting that, but it worked. She obviously stimulated her own endorphins and had no pain. And the baby, oh my God, was so peaceful, so serene. I held the baby, and it was just unbelievable.
We had somebody, Kim Miller's in a class I'm teaching, and one of the other members of the class gave birth on Thanksgiving. And she said every single contraction she had, she moved into the mindful place within her, and it changed. It's her third child. It totally changed the experience for her.
Isn't that very interesting? So that we make our own morphine is very interesting. We just learn how to stimulate through meditation and things which we'll be speaking about. Aren't most stress reactions automatic and not conscious?
Yes, they are. People can say, "Oh, I feel great," but again, if that tiger is or the lion is there, then immediately it goes so fast in the brain.
You don't have to think.
No,
it just happens like that.
It has to happen that way. I mean, that's the natural thing in an acute situation.
And can we become mindful in a stress reaction of chronic pain? Is that what you teach?
Yes, we can.
At your courses?
Yes.
And you can take a chronic pain patient who's on 4 or 5 medications, like I saw one the other day, following a minor accident, went to a pain center, and they've got them on Ambien, Neurontin, and Lyrica, and morphine, and Vicodin. It's just a horrible situation. And 10 pages of things that they've done to him. You can take a patient like that if he participates properly and reduces pain tremendously.
Yeah, there's my experience tells me that, and also a lot of research. Some of the first classes that were done in stress reduction in Worcester, Massachusetts, showed that pain patients on average had about a 50 to 55% reduction in their pain in an 8-week course. That's pretty amazing.
That is amazing, because you're going to take a person who could be suicidal or become addicted and can avoid these, and we really need a big dose of that in this country, because I see a tremendous amount of addiction with narcotics to prescriptions. Does how you think cause illness in your body?
Oh, absolutely. That's, again, we go back to the 2 arrows, because the 1 arrow is physically what happens. If somebody actually shoots an arrow into I'm going to feel it. But the second arrow is precisely my thoughts and emotions. that let's say somebody is job is a little bit rocky, not sure what's going on, and they begin to say, I'm going to lose my job. I'm going to lose my job. And physiologically, that when I think that, it's as if it's the case for me physiologically, that whatever we imagine and we keep going over and over again. I read someplace that the average person has 65 to 70,000 thoughts a day. I've never counted mine. I don't know if you've counted yours. But however many thoughts, if we keep repeating those things, oh my gosh, this pain that I'm having is going to mean that I can't drive anymore. It's going to mean that I can't work anymore. It's going to mean that I'm going to lose my family. I mean, all of those thoughts rev up our brain. That goes right into the midbrain.
Through hormones and neurotransmitters.
Right. It's all happening.
Neuropeptides.
Yes.
Our brain speaks to our body.
Yes.
And then the whole body gets involved with our thought process. Incidentally, since you brought up the number of thoughts per day, I do some lecturing on the diet, and the average number of thoughts we have about eating, Richard, is 200.
Might depend upon the day.
and I think maybe a few more than that.
Yeah, I would
this
say.
Christmas season, all the desserts. And I mentioned here a minute, and I meant to ask you, and I think you kind of brought it up already. How does the mind speak to the body? And we talked about neuropeptides and neurotransmitters and hormones that are secreted and stimulated from our hypothalamus and in our brain. Our limbic system can send these out through nervous impulses, but also into the bloodstream and speaks directly through our 70 trillion cells. So our thought process can indeed speak to our whole body. You wake up angry, your whole body is angry because of these hormones and neurotransmitter. You wake up happy, your whole body is happy.
And that's one of the main things about stress is that it's non-specific. I mean, if I want to pick up a book, then the muscles in my hand are very specific. But stress is non-specific. It's all of me. Yeah. So either I'm feeling this sort of global stress or I mindfully look at what's going on and change my perception. But the main thing is how many people are looking at their thoughts simply as thoughts. It's a thought. I'm having a thought. That's what's happening. But we tend to identify with our thoughts. And then if they're negative, and a lot of them are, then they rev us up in a particular way.
Yeah. They spread through nerves throughout the body, and these hormones and neurotransmitters, neuropeptides, they go throughout the body because they get secreted in the blood system. So our whole body, 70 trillion cells, become affected by our thought process. When Candace Pert wrote about this great book, Molecules of Emotion, she published in 1972, she also spoke about that the 350 neuropeptides that are made in your brain and hypothalamus that you can speak to your body with. You don't speak just to your body with nerve impulses and neurotransmitters. It's also done through neuropeptides.
Yes.
What she described was your white cells in your body also make those 350 neuropeptides also in your immune system. So they in turn can speak to your brain. So it's brain-body, it's body-brain. So you can see how important our thought process really is all about.
Could I add to that one that one of the studies, I think done in 82 or 83, looked at mindfulness in relationship to the immune system. They had people in Wisconsin doing their jobs, and they split them up into different groups. And the group that was doing the mindfulness had better immune system. That when we talk about mindfulness, people don't think about the immune system, but it, of course, directly affects all of our cells. It's essential that would happen.
Yeah, and they've proven now, too, that cancer rates are less in the patients who've practiced mindfulness, and cancer rates are higher in people who are stressed out.
Yes.
And matter of fact, I had a good friend, chief of police, Marion, Indiana. A real dear friend of mine. Matter of fact, his wife was born the same day I was born, so she must be 39. Unfortunately, she recently died. And she had no illness, didn't smoke, moved out of town 6 months, comes down with cancer and dies. Remember Krista Reeves and his wife? She never smokes. Within a year, she dies from cancer. Stress. Stress did that, destroyed their immunity.
Yes.
And when we speak of mind-body illnesses, which you've read my book, Welcome to Your Mind-Body, I've listed on there the mind-body index about the number of illnesses that are caused by the human mind, which is astronomical, but there's 20. I mean, from fibromyalgia
Oh, yes.
to cancer to chronic pain to headaches to irritable bowel. There are 400 million brain cells in our bowel. 400 million brain cells in our bowel. Most of the serotonin that makes us feel good, Richard, is made by our bowel, not by our brain. So how we think has tremendous effects on our gastrointestinal symptoms, and that's why we see 30, 40 million patients with gastrointestinal irritable bowel syndrome and things of this nature. Period. Wouldn't mindfulness, Richard, teaching be best way to treat mind-body illnesses, since the majority are caused by stress, instead of tranquilizers and narcotics and medications and injections?
There's no doubt in my mind that in the next generation or so, more and more people are going to cue into mindfulness because it works. The evidence is astonishing. There were 150 articles written about mindfulness and its effects on all of these diseases that we're talking about in between January and June of this year. And back in 3 years ago, the whole year there were 70. It's an exploding field of awareness. And the problem is most people don't know about it. The more we learn about it, the better. I wanted to bring Kim Miller in it because he's just finishing a class with me.
Yes,
and
thank you.
So part of it is looking at stress reduction and mindfulness. And maybe you could just talk a little bit about your experience in the course and what impact that has on your life.
Well, until about 3-4 years ago, I was in a very reactive mode in my life. Stress would come up, my mind and my body would just run with it. I did not realize that there was any other way. 3 years ago, I retired from my career and decided that I was going to do some different things in life. I was going to spend more time dealing with spirituality that I had not done before. I got into meditation on an informal basis. And I even to those limited extents, I saw great changes in my life, a much more peaceful attitude and much more able to deal with stress. What the class did for me was to offer a formal, little bit of a formal education on these subjects. We got into various kinds of meditation, sitting, walking, the body scan. We got into some yoga, which I had been wanting to do for many years and just hadn't gotten. It just wasn't time until I took this class. It was just a great, short but comprehensive introduction to a more formal way to live, to a more formal way to be calmer, more peaceful, to be proactive, and to take preventive measures to create and continue my good health.
You really learned that your mind affected your body, didn't you?
Yes.
Really, which
Yes,
you probably
I did.
didn't appreciate as much beforehand.
I knew that before, but there
Yeah.
again, this emphasized that.
Let me ask you this, Richard. What's your opinion on prescription drugs as being the biggest cause of drug addiction in our city and the whole country? You've heard me speak about this before.
It's so
Give
painful.
me your own thoughts as a PhD and not a medical doctor on this subject. Sometimes the public, I think, is more aware of it than us subscribers of the medications.
Right.
What are your thoughts on that?
Just a little bit of my history. When I was young, I grew up I went to college in the 60s, and I lost good friends to drugs that were illegal. And I didn't, for a long time, ever think about the problem of prescribed legal drugs. It just seemed like there was legal and there's illegal, and legal was done in such a way. And then I began to talk with people who were having addictions to Vicodin, and I said, well, wait a second. I don't understand that. That's a prescription drug. Why would that happen? And the people were stealing them and all that stuff. So the amount of drugs that people are taking, I've done some work at the Center for Nonviolence and for years, and so we would do interviews with people and ask them what their experiences are. And I thought that I'd hear about illegal drugs, but I was hearing all of these stories about legal drugs, and I thought, wait a second, and it really shook me. It shook me because it shook my confidence in the medical profession, because I couldn't. It seems like if I were a doctor, what I try to do is what's the least invasion of whatever's going on in somebody, the least amount of drugs, and I would always err maybe to the conservative side. But I guess in this culture right now, it's the biggest use, and I tell you, it shocks me. It's difficult for me.
I totally agree, Richard. That's part of the reason I'm doing this program. I do what I do, and things that I write about. I'm writing a book on chronic pain coming out shortly, and it's pretty brutal. I mean, what I'm looking at is pain centers doing 50 to 100 injections a day. And when they don't work a lot of the time, what do they do then? Hand them narcotics. I know of a place where the addicts are lying in the hallway, where they're lined up to get their prescription refilled, and every time they need a refill, guess what? They get a charge. I've had patients say to me, you know, doctor, I'm a legal addict. And they're right. They are a legal addict. They are a legal addict because they have legally a prescription from their physician. For a lot of the time, not a very good reason. And I wrote a book, called The Nocebo, the Evil Twin.
Yes.
The placebo, could be a pill, it could be me, it could be a procedure where the patient believes it works, and it will work for a period of time. Even an necessary operation will work for a couple of months because of belief. They believe it. The nocebo is the opposite. Probably something, the term you may not have even heard before, Kim.
I have not.
But I think it's a great title for a book, though, isn't Nocebo, the Evil Twin?
Yes.
Isn't that really great? And because it is an evil twin, where they take diagnostic studies which have nothing to do with your problem and convince you need this injection or this procedure. When you think about it, if you pick up the New York Times today, page 18A, if you read that about angioplasties, is a brutal article, So what do you think that doctor who was, I think is being convicted about doing too many of these angioplasties, what do you think he was doing? He was using the nocebo of the angiogram, showing some minor changes, making a big thing out of it. He was noceboing the patient, then he agreed to have the procedure. So it doesn't apply just to our pain syndromes that we're talking about, back problems or whatever. It applies across the whole medical field.
And it shows the power of the mind.
And it shows the power of the mind.
So placebos?
People get convinced enough to lay down on the table to get an angioplasty done when they didn't need it.
Either
of course,
nocebo
many
or
of them are
placebo.
needed. That's not the point. Many of them are needed.
Yeah. Oh, yeah.
But it's a problem throughout medicine, and I don't just go at any one specialty. It's throughout human kind. And so tell me something about meditation, which is a strong part of mindfulness teaching.
It is.
Tell us about the value of meditation. I meditate for a couple of minutes a day. And tell us a little bit about that, Richard.
Well, meditation is one of the most useful things we can find to help us. One of the things it does is it changes our happiness point. That we think that in the 1990s, the research was that you're just stuck.
Yeah.
If you're sometime 20% of the time you're happy and 80% of the time you're unhappy, tough luck. That's how you're going to be your whole life. They said it was set. We know that set point is a myth, that it can change, and the primary way it can change is through meditation. That by meditation, what we're doing is we're, instead of activating the sympathetic nervous system, which revs us up, we're activating the parasympathetic system. So it's another part of us, and that when we activate that system, we're able to relax, we're able to be mindful, we're able to look at life in a completely different way. And it's an amazing thing because 10 minutes, 15 minutes, half hour, whatever somebody does at the beginning of the day tends to have an impact throughout hours. It's not perfect, nothing's perfect, but the more we meditate, the more regularly we meditate, the better. And one of the most important things about it is the breath. For us to pay attention to our own breath. When I'm breathing automatically. When I'm breathing and I become aware of my breathing, then I'm taking my focus off thoughts about, oh my gosh, what did I do yesterday? Oh my gosh, what's going to happen tomorrow? I bring it in the here and now. I come back to mindfulness. So mindful meditation is using breath, paying attention to my body, as I expand my lungs and I contract. Those experiences, I begin to practice being here and now, and I also learn concentration. As a neurosurgeon, that's important. But all jobs, in every job in the world, but in our relationships, if I'm with my partner, with Teresa, and she says something and I'm spacing out, I'm not paying attention to her, that hurts our relationship. But when
Yeah.
I can concentrate on what she says, or when Kim is speaking, or when you're speaking, and I'm totally with you as that happens, I'm being mindful, and my meditation trains me for that. So it's one of the most important things. It's the research about right down to the chromosomal level, that our chromosomes function better when we are meditating, because it changes our chemistry. So it's extremely important.
Thank you very much for the great explanation. Tell me, Richard, what is body scan? You hear about it, I read it in the literature of mindfulness and things. What is a body scan, and what use would it have in the treatment of chronic pain?
I'll say a little bit about it, and then maybe Kim can chime in, because he's been doing it. Body scan is a lying down meditation. And what you're doing, I mentioned before that I can, when I'm breathing in and out, like in sitting meditation, I can pay attention to my lungs and the air coming through my nostrils. In a body scan, typically the person lies down, although they could sit or stand. And what they're doing is, we're saying at a certain point, now bring your attention to your left foot. And you just focus your attention on that foot. And let's say, then you start thinking, oh, I better go do left foot. Just focus on that. And you go through your whole body, part by part, and you're practicing concentration. You're practicing mindfulness. And you keep coming back until more and more of the time you're simply present in your body. Then you do the whole body. Kim, anything about your experience of the body scan?
Well, it's a lot like focusing on your breathing.
Yes.
You're focusing on your various body parts. And one thing that I did during that exercise was not only to focus on that body part, but to surround it with good energy. Surround it with love while you're at each of those points. Again, a preventive, proactive strategy to maintain and continue what I am very fortunate to have, excellent health. Just a daily practice, or a few times a week to sort of visit various parts of your being.
And you know, most of us are not well connected with our bodies. That we're much more connected with our emotions and our thoughts.
With the outside world.
Everything is out like this.
Yeah.
But when I focus on my body, I create more harmony. I like it when you think about some kind of love or acceptance, to look at our bodies as our friends, as our partners, as somebody who goes through life. I mean, there's so much, I have pain in my body, so there's something wrong with me and wrong with my body. Usually there's a reason. And if we are more accepting and loving of our bodies, then it changes things. So the body scan is one way to just bring greater acceptance and friendliness and kindness to our own physical self.
Another aspect of that was just to appreciate each of those body parts.
Yes.
Thank them for what they do for you. Visualize them working correctly,
and we can relax them, and that's a good idea. But it's still helpful, even if I don't have tension in let's say my neck, to be present in that part of my body is a form of appreciation, and often we just don't do it.
Can you discuss, Richard, and I'll discuss them too, some of the more main holistic treatments for stress and chronic pain? You know, they would come to our Mind Body Institute. What are we going to do for them?
Right. Well, I come to the Institute for yoga. I love yoga. It's real helpful. There's Tai Chi. There's any kind of working out, any kind of regular exercise, fitness exercises, strength exercises, which are
yoga is meditation, isn't it?
Oh, absolutely. It is meditation in motion.
Yeah.
And we teach it in the mindfulness classes. So that those are very helpful. I think playing sports, as long as we're playing it in a way that's just fun. You know, I mean, you can do well, but when I'm swimming, I swam right before I came.
Yeah.
And I'm swimming, and there's nothing wrong with the world. I just, unless I can't get a lane. Anyway, I just love to swim, or whatever it is that we do. But that's more bringing our connection to our body. And I think that's a very.
And if you were paying attention to your strokes, really concentrate, that's meditation, isn't it?
Absolutely.
If you're doing the dishes and you're looking at the dishes and you're looking at the flowers, looking at the forks and their design, that's meditation.
Anything can be done in that way.
Anything can be meditation,
Yes.
as long as you're concentrating on what you're doing.
Right.
Isn't that true?
We have formal practices, formal meditations, but then what we're teaching in the classes that I teach is, we're saying, now take that into your life. I remember when I became a mindful dishwasher. You know, I
I love
just didn't
it.
want to dishwash it. And I said, you know, I'm only
it.
going to do it, and I get a kind of sudsy, and I do this and that, and pretty soon I'm into it, and then it's just a meditation.
I wish I'd been more mindful. My wife was out of town, and I was practicing my saxophone, but I was doing boiling some eggs at the same time. Forgot about the eggs, and it came out. They almost burned the whole house down. I should have been a little more mindful that day.
The practicality of mindfulness.
I know. Let's discuss again for a minute because I think it's so important. Is pain a symptom? And this is what I need the medical community to get straight, and the patient community also. But the responsible people, even more important, is pain a symptom or a diagnosis?
I am sure that it's a symptom of something else that's going on. There's the two arrows, right?
Yeah, it's arrow one or arrow two.
Yeah, or usually a combination of both.
Yeah.
And I love it that you emphasize that the pain is real. The pain
Absolutely.
is real, but it is not seen widely enough that there's something behind it. I mean, when all my
That's
teaching,
the word. There's something behind it.
in all my life, whatever's going on, what is behind it? If we don't know what's behind it, if we don't know the cause, then we can't come up with a solution.
I think this is a very good explanation. I think that's the whole problem. They'll go to a pain center or the doctor, a minor problem, and are right away to the pain center, and they have an x-ray, do a nocebo on them, overread the x-rays, not every time, a lot of the time, and we're often running with injections and narcotics, and now we're ruining their lives. I see this every day. Every day do I see samples of that, and I think it needs to be changed. And tell us again if you can come up with it, otherwise I'll try. You gave me the title of this Dr. Nix that we're having coming in March, she's essentially in charge of the chronic pain problems in Ontario, Canada, and she's head of the society and everything, and she's going to give a wonderful lecture. And you thought of the name of the lecture. Do you remember? Can you tell it?
Our meditation and mindfulness, the morphine and marijuana in pain management of the 21st century. Oh, good, I remember.
Perfect. I was right behind you, but I didn't remember as good as you. Isn't that a wonderful title?
March the 19th.
March the 19th.
2011.
At the Cashman Auditorium at
11
the
a.m.
hospital, and I think we're going to have a big crowd. That's what pain management needs to change into.
Yes.
Obviously, there's not much money in it, and then that's just fine because we're trying to change something.
Yes.
And it's much healthier, better for the patient, and so it'd be difficult to change the community towards that because of I think the money issue. But it's got to be the wave of the future. We can't give these people injections of narcotics and do dumb things to them. This must change, I think we're leading the change. We're bringing in people from outside the country to talk about it.
And in economically difficult times. These are difficult times.
These are difficult times.
The amount of money that people are spending is astronomical.
It's astronomical.
The bankruptcies related often to medical problems. And if people can spend this time in what is basically self-care and self-regulation, when we do that, our lives are so much better. It's really not up to somebody else. I mean, of course, doctors can help and everybody can help, but bottom line, I need to be taking charge of my thoughts, my emotions, and my physical sensations as much as I possibly can.
Yeah, and it will not be easy because I treat some of these patients, and anymore I always would say to them, and what's going on in your life?
Yes.
That my opening statement, instead of saying, where do you hurt? And you get a pretty good thing. But you know what I've done lately, which worked very well, a patient I have at the hospital right now, I give them a yellow pad and a pencil.
I love it.
And what I'm learning, it's a great technique. If there's any doctor watching, try that. You can really learn your patient. She gave me 20 pages. And I really know my patient now. And our relationship has improved 1,000%. She knows my heart is next to her heart.
That is so important.
And I will make her better.
I wanted to mention about a study about journaling. They did a study to look at people who did talk therapy, one group, and the other group journaled. And the group who journaled did better because they were more honest. they were talking to themselves.
Just talking to themselves. That's interesting.
No reason to lie about it.
That's
but anyway, I wrote a book about journaling years ago.
That's very interesting. And tell me this, Richard. What's the difference between responding to pain and stress instead of reacting to it, and which is better?
Okay. Maybe I can pull Kim into this too.
Yeah.
Okay, so what's happening is the stress reactivity is all of those physiological changes that you talked about. The shutting down the immune system, the gastrointestinal system, all that. That's reacting. It's like I react like that. You know, I'm trying to shove and push away whatever the experience is.
Yeah.
When I respond to a situation, stress response, I am mindfully looking at what's going on. I'm accepting what's going on. I'm looking in the clear mirror, and I see it, and I just say, "Whew, this is really what's happening," you know. And I'm not.
You're stripping it of the reaction,
yes,
where most of the discomfort and pain really is located.
That's right.
Just looking at it in its bare purity.
Yes.
But in reactivity, we start drinking and smoking and tattooing. I see a lot of patients have a horrible amount of tattoos.
Right.
Who have chronic pain problems,
right.
obviously.
Those are maladaptive, as you know, maladaptive strategies that people, I mean, everybody wants to have less stress. When I say I teach stress reduction, I got stress, you know, but then how do we deal with it? So let me just check with Kim about the stress reactivity and the stress responding. Can you think about that, an example, or how that works for you?
A great moment in my life a few years ago was when I realized that I could, rather than automatically react to a stressful situation, I could pause. I could take a little time. This isn't the tiger situation, but the normal, everyday, stressful situation. I could pause. I could think about that. I could evaluate it. I could decide what's a better way to deal with this. And I sort of visualize myself, maybe a part of myself, a higher part of myself, sort of moving above the rest of me, moving above the mind, kind of viewing my mind and my body, my being from a little bit of an elevated position, and taking some of these proactive means of dealing with the situation. And I found it especially valuable in relationship situations. We all have our relationship issues, and those are very easy to react and get into heated arguments and so on. That pause, that moving away from the situation and taking time to think about what's the best response to whatever comment that was made, or what's the most loving response to this situation. You can just turn the tables on the whole.
Kim, that was a beautiful explanation.
It was.
Don't you think, Richard?
It was excellent.
That was an excellent explanation.
You know, I was walking into the library tonight, and two people were in the corner yelling at each other, just yelling at each other. I spent a little time listening. And it was just so interesting because this person and each person was reacting and reacting and reacting to the other person. Just all these reactions. Yeah. But in a relationship, if some person stops reacting, it totally changes the dynamics. If you're going, shh, somebody goes, and then they just listen, and then they say, oh, that could be, or, well, you know, thanks for sharing, or whatever. But we move out of that.
It's very interesting, Richard, you would say like that, because, you know, I take a little interest in what's in the newspaper, and I've been telling them about the wars going on all along. Suppose one of us stops reacting, what do you think would happen? We might have peace.
Exactly.
We might have peace.
And talk about chronic stress. The war zones are just epidemics of chronic stress. The level of pain and suffering that people do in these wars.
Incomprehensible.
Absolutely. So there's stress. Somebody can have stress in their physical body. They can have stress psychologically, but there's social stress, and social stress it affects everybody. It affects everybody. So a war zone or great conflicts in a culture, when people are like this, it causes impacts on everybody around. It requires more mindfulness on our part to be able to handle it.
We can't comprehend what wars have done to people.
Oh no.
You just can't.
And it goes on for the rest of their life.
And it goes the rest of their life.
Yes.
And veterans, rest of their lives, they're going to be dealing with the injuries they've received and things. Yes. And I'm a veteran myself. And how old is the teaching of mindfulness, Richard?
2,600 years, approximately.
Wow. The answer came out like that.
The teaching is from Buddha,
Yeah.
Although, of course, it's in all religions. Every
Yeah.
religion teaches it differently. But the first time that we read about it
Yeah.
is there are a couple of writings by Buddha. That two-arrow.
But we don't look at it as a religion.
No.
We look at it as
No.
physiology
This is
of the
just
human body.
this is just
Yeah.
how it all works.
Yeah.
That in all religions, all philosophies that I've read that make
Yeah.
sense. For example, it's very big in Greek philosophy as well. But the word mindfulness comes primarily from Buddhist texts, in which the whole idea is, let's pay attention to the body, let's pay attention to the emotions, let's pay attention to the mind. Let's practice that so that in our daily lives we're not reacting, but we're peacefully present.
And part of their philosophy too is, which is actually true, and if you really look at it barely, I mean, life, one time or another, is suffering, isn't it?
Absolutely.
I mean, there isn't a person that comes through this life without suffering.
Some people overemphasize their suffering, and they go, make a big deal about it, and that's not helpful. But some people pretend that they don't suffer, and that's not helpful either. It's back to that clear mirror, to be able to see through my glasses and say, this is what my life is about. This is really what's going on.
Yeah. In most of our lives, not everything, including a marriage, a job, and these things are temporary. I mean, there's
Everything is temporary.
Everything is temporary, and we need to learn how to deal with it in a friendly manner as possible without getting ourselves addicted to things and having things done to us that we don't need. I think is very important. And tell us, Richard, what is holistic medicine, integrative medicine, complementary alternative medicine? You hear these terms, they probably could be a little bit confused. Any thoughts on that?
Well, what I like about holistic is it's based with the word whole and healing. It goes back to the ancient Old English. So we try to be whole. Kim was talking about looking at things from a more spiritual perspective in life, instead of being caught in, so like here we are, and we rise up above the trees, and we can see the individual trees, the individual things that are going on in our lives. That's very helpful. That's the whole approach. And I think that's the best, because all of life, either we see it as separate little disconnected pieces, or we see it as a whole. And the more I see my life as a whole, whether it's holistic medicine or holistic living, I want to be whole. Everybody wants to be treated as a whole person. You know?
And I think as a patient, as a doctor talking to a patient, I mean, I like to look at the physical aspect of them, the history of them, the physiology of them, the spirituality of them, and fully inform them so they can be part of the decision-making process, including the family. To me, that's holistic.
I agree.
And you hear the term a lot today, integrative medicine, integrating the holistic aspect into it. And I don't like the term complementary alternative medicine. This is not a complement.
This goes
mainstream.
Goes back to Hippocrates, doesn't it?
Yeah, this is mainstream. Hippocrates practiced this way.
Exactly.
And going back thousands of years. It's just since Descartes chopped the head off the body in 1635,
Yes, he did.
where we gave the mind to the church and the body to medicine, that we have not reattached the human brain to the body. So we're practicing medicine really without the brain a great deal today.
Right.
And it's very difficult to change. And mindfulness means paying attention, doesn't it? Is that
does.
Really
Yes.
is the main thing?
I'm awake in the moment.
Yeah.
Right. That I'm going on. I mean, we go in life sometimes, and we're on automatic pilot. We don't know what's going on.
Yeah.
Somebody mentioned that you could be taking a shower and you don't even feel the water. That you're remembering some meeting that you had, and all of a sudden there's 20 people in your shower because you're not even in that, you're not even present in that moment. So to me, the most important thing is to be completely present in whatever's happening in the moment.
Yeah. Is the breath our ally in this hearing process, meditation and breathing? Are they a huge part of this process of
it's
mindfulness?
the best research on meditation is to focus on breath. There's a gazillion different kinds of meditation, but if you keep moving back to the practicality of the breath, there's something about the breath that keeps us present in the moment.
What's the longest time you've ever spent meditating?
I did do
You can answer that too, Ken.
I did a 5-day silent retreat, and it was essentially 11 hours a day of meditation for 5 days.
Did you?
And did my mind ever wander? Yes. But for the most part, I was very present in that. So that's probably my longest period of time meditating.
Well, that's very interesting. I do it about a couple of minutes a day, some days longer. How about you, Kim? What's the longest you've spent at it?
Probably the longest I've spent was at our day-long retreat that was part of the MBSR class.
Yeah.
What was that, 9 until 4? I mean, we took little breaks, but most of that was a meditative experience.
But come back with what you said before. You can play tennis in a meditative state. You can. I can wash the dishes in a meditative. For example, driving. I used to be like, I'm not there where I want to be. And I began to say, I don't have to be there. I can be here. I'm on the way. I encountered a lot of traffic on Coldwater. Coming in, I was a few minutes late. I said, okay, well, I'm doing the best I can. You know, I didn't know there'd be that much traffic on Coldwater. So I think it's possible to
calm your mind and
just move into that space wherever I would like. I mean, somebody talks about constant meditation, and I'm not there, but I'd like to have more and more of my life be essentially a form of meditation.
Yeah. Can mindfulness teaching reduce cancer, heart disease, strokes, many other mind-body illnesses?
Yes, and there's research. It's not just what you and I think about it.
Yeah.
There's a huge body of research. I talked about all those articles. I read 5 articles that have happened in year 2010 that talk about the impact of mindfulness on cancer. Supposed to be, cancer, we can't have an impact on cancer. But some of it is caused by stress. And anything that's caused by stress can be transformed by mindfulness.
Yeah, I have about 3 books I highly recommend people to read who have cancer. They're on my website, Cash on Mind Body, which I think are very effective. Dr. LeShan, 45 years treated terminal cancer. He found he could double the lifespan of the 90% of the cancer patients by teaching them mindfulness and giving them a purpose in life, Richard.
Purpose
that was very
is key.
effective.
Yes. Absolutely.
If you could give them a purpose, he could double the lifespan 90% of the time. Very interesting. It's a very good book on my website. I found mindfulness teaching can help headaches.
Oh yeah. Yes.
A great deal.
Oh, yes.
So, in the course that you'll be offering at the Cash for Mind Body Institute, Richard, how long do you plan for it to be? Do you plan to have different grades of it? One a week or 2, another one a month or 2, or sort of what are you plans? You know, of course, I highly encourage Richard to do this because I want to reduce the amount of drug addiction that I see in this community. Could you tell me what your plans are, Richard?
Sure. But the basic class that I offer that I learned about in Worcester is a class that has 8 2.5-hour classes and then a day-long retreat. So that's the basic one. I'd like to try other forms, but that's the basic one that I'm prepared to teach.
Yeah, thank you, Richard. And
You're about out of time.
one can sign up at our classes by calling 260-436-2040. We have about 26 different types of modalities of treating stress, from Zumba dancing to yoga to mindfulness teaching, from laughter and stress, and we have all sorts of modalities. And I give a free lecture once a month at the Cashman Auditorium at Lutheran Hospital. We have about 300 seats. We normally have a nice crowd, and it is totally free. And all these lectures about the effects of the human mind, human body. And I'm Dr. Wellness. That's what I am. That's what I'm trying to do. I'm a surgeon by profession, but I'll be honest with you, if you haven't noticed tonight, my passion is wellness. And indeed, we are getting a lot of people well. I have a book coming out shortly on reversing type 2 diabetes in 60 days. Can you imagine that?
Wonderful.
And I stand totally behind that. And there's literature behind me, and we've been doing it there. And I've written many books about psychology of eating. And then I have a pretty brutal book coming out very shortly, The Fraud of Chronic Pain. Fraud of chronic pain, really exposing this chronic pain problem, trying to reduce the amount of deaths and addictions that I see in this community. Thank you very much for watching. This is a wonderful discussion. And Kim and Richard, thanks for coming.
Thank you.
We're going to do this again.